MrBeast, the biggest YouTuber in the world, suffers from a chronic incurable disease that has tormented him since he was 15 years old. Imagine not being able to eat what you want because every bite can turn into unbearable pain. Chronic diarrhea, extreme fatigue, weight loss, that's what millions of people face with Crohn's disease. But here's the most surprising part. MrBeast has not only learned to live with this disease, but he has built a multi-million-dollar empire in the process. How does it affect Crohn's, the body? And most importantly, how can you manage it if you or someone close to you suffers from it? What is Crohn's disease? Crohn's disease is a chronic inflammatory disorder of the digestive tract. Unlike irritable bowel syndrome, which is milder, Crohn's can cause severe inflammation that can damage intestinal tissues. Unlike other digestive diseases, Crohn's affects any part of the digestive tract, from the mouth to the anus, and appears in patches, leaving healthy parts between inflamed areas. It can cause serious complications such as fistulas, ulcers, and nutritional deficiencies. The symptoms of Crohn's vary, but the most common include diarrhea, chronic, sometimes with blood, intense abdominal pain, lack of appetite and weight loss, extreme fatigue, inflammation in other parts of the body, such as joints and skin. These symptoms can come and go with periods of flare-ups and remission. In severe cases, it may be necessary to operate and remove parts of the intestine. The story of MrBeast, when Jimmy Donaldson, better known as MrBeast, was diagnosed with Crohn's at the age of 15, his life changed completely. He couldn't play sports, he had to follow a strict diet and experienced extreme exhaustion. To avoid relapses, MrBeast eliminated foods like refined sugars, saturated fats, and ultra-processed foods, gluten, and dairy products. Additionally, he follows a medical treatment that includes medications, immunosuppressants, and adjustments to his diet. What causes Crohn's disease? Although an exact cause is not known, science has identified 3 key factors that increase the risk. 1. Genetic factor. If someone in your family has Crohn's, the risk increases significantly. However, now with new discoveries in epigenetics, the opposite has been demonstrated. Your genes are not your destiny, rather, your lifestyle controls them. 2. Diet and lifestyle. Excessive consumption of ultra-processed foods, trans fats, and refined carbohydrates can alter the gut microbiota and increase inflammation. Number 3. Chronic stress and immune system. Extreme stress can trigger, and some studies suggest that the immune system mistakenly attacks gut bacteria, causing inflammation. How is it diagnosed? Crohn's? To confirm the disease, doctors use colonoscopy with biopsy to observe inflammation and intestinal damage, blood tests and inflammatory marker tests, stool tests to detect inflammation or infections. Here are the treatments and solutions to improve the quantity and quality of life. Dietary changes. One of the best ways to reduce symptoms is to adjust the diet to a low-residue diet to avoid irritation during flare-ups, increase probiotics to improve gut microbiota, reduce refined sugars, and ultra-processed foods. Methods to control stress and improve emotional well-being. Stress is a major trigger for Crohn's flare-ups. Techniques like meditation, grounding, and deep breathing can help reduce inflammation. Stay tuned to this channel where I will make more detailed videos about these techniques, which will help you manage stress levels. Supplements and functional medicine. Some patients have seen improvements using curcumin and omega-3, which are natural anti-inflammatories. Vitamin D, which helps the immune system. Specific probiotics to strengthen the intestinal microbiota. What are the medical therapies in severe cases? Doctors may prescribe medications, immunosuppressants, antibiotics to prevent intestinal infections, or perform surgeries in extreme cases. In conclusion, Crohn's disease does not have a cure yet, but with the right approach, one can live a full and healthy life. MrBeast is a great example of how discipline and lifestyle changes can manage the disease without letting it limit your dreams. And now I want to know your opinion. Do you think that diet and lifestyle play a key role in chronic diseases like Crohn's? Leave me your answers in the comments. Share your video if you consider this information important and that someone else needs it. Remember that health is the most valuable thing we have, and without health, we have nothing.